Going live on Facebook. All right, perfect. All right, so we are live on Facebook. Room is filling up. Wow, quite a few people here. Lots of folks here. Oh, hey, Dr. Miller. I see a familiar face, Dr. Miller. All right, guys, so what we're going to do is we're going to allow just a couple of minutes for the room to fill up because I still see more people coming in. And we will start momentarily. Okay, let's take a peek here. There's a nice little crowd here. This is awesome. Kary, you're famous.
Yeah. I have a fan base already.
All right, so let's see here. We still have some more people coming in. Guys, we're going to start in just a couple of minutes. All right, guys, we're just going to start momentarily, and I'm just going to check on Facebook, and then we'll get started very, very soon. All right, guys, it looks like we have a lot of folks in here. Let me go ahead and get this started. I'm super, super excited for this. Put this here.
I'm laughing. It says I'm Kary Helmer down there.
Oh, that was put in wrong. You're definitely not Kathy, that's for sure. Okay, so let's get started here. All right, well, welcome everyone tonight for Sleep TV. My name is Cindy Acevedo with Sleep Group Solutions. And first and foremost, I'm going to be going ahead and speaking with Kary this evening regarding on how sleep is running in her office, her role as a sleep care coordinator, because when introducing dental sleep medicine into your practice, the one thing to remember is this is very much staff driven. So even though the dentist comes in and can speak with the patient from time to time, this is really run by team members, most importantly by a dedicated person who runs sleep. And in this case, this is going to be Kary, which is why I asked her to join us this evening. So I'm going to go ahead and get us started here. So Kary, first of all, I want to say thank you for sharing your Tuesday evening with us. I really, really do appreciate it. So thank you so much for joining us tonight.
Anything for you, my love.
Thank you. Thank you. Thank you. So let me go ahead and put this here so we can get started. Guys, if anybody has any questions, please, you can go ahead and put it in the chat here, either on Facebook or in the Zoom room, and then we'll go ahead and get into that. So Kary, just to get started for this evening, I wanted to get, at least to share your feedback with the crowd here in terms of how you got started into dental sleep medicine. Like what brought you into this realm of sleep?
Sure. That's easy. So I've been with the practice I'm at for the last 8 years, and we've been practicing oral systemic medicine since then. And so it was an easy transition for us to understand that sleep's an important part of that. And so we incorporated a little bit of sleep. Like a few years ago, we have done a few sleep studies. We did a couple of dental appliances. And a couple of us were trained. The doctor and I were trained, not our current staff now, but the doctor and I were kind of trained a little bit in sleep. So that was kind of the start of our piquing our interest in that, going to some oral systemic medicine conferences and learning how important sleep is. And then Amanda Carter, that works for you guys, is a friend of mine. She and I have been in the dental world together for a long time. She's obviously was with other companies before y'all, so I've known her throughout the years and her dental career too. And so she was on me. She was on me like flies on, you know.
To get started in sleep.
To get started in sleep, yeah. Well, to get started with you guys, and I was like, I don't know what SGS is. Just like, leave me alone for a little while. I mean, she was chasing me. She was chasing me hard. But when I finally realized what it was, and she explained it a lot more, I said, yeah, well, come on, let's talk about it. Come to the office, let's chat about it. So she brought her portable, the Echo Vision that's portable, which is so cool, to show us what it was all about. And then, once she kind of showed us, we were like invested. I felt like I was invested. I feel like most of us were kind of invested in learning more about it at that point. So she was able to easily talk us into, or at least those that were able to attend. Shira, my hygienist, and I had booked to go to y'all's class that y'all do, where you kind of let dentists know about what you're up to, right? You could probably speak more to that, because I didn't get to go to it. Shira, my hygienist, did. I couldn't go that night, but it was like a 2-day thing where you kind of learn an intro to sleep medicine and learn about what you guys are doing and how y'all are able to. So once she came back from that, and I had, we had some knowledge ready to go, we kind of decided to start really implementing it more in our practice.
That's awesome. Now, and then we'll touch base later about the 2-day course that you were talking about, because I know a lot of people can learn from that, and you've been to some of our other events as well. But being that you're now, fast forward, you're now the dedicated sleep care coordinator for the practice. And, just to share, like what state do you practice in, just so everyone knows like where you're doing sleep?
Yeah, we're in Dallas, Texas.
Gotcha. Perfect. And you being now the dedicated sleep care coordinator, are there any signs or symptoms that you've seen in patients that others may not be related to an airway issue? Because I know that a lot of folks in dental practices, they see patients day in, day out. There's hygiene visits. There's tons of stuff that they're seeing. And it's not till after you've been trained where you look back and you recall all of those other patients and say, I had no idea that was a sign or a symptom. Like, what are the most common things you see in your dental practice?
I think not just the most common things, but the easiest things for every team member to spot, because they're such prevalent health conditions in our practices, is thyroid disease, for one, hyper and hypo, and high blood pressure. But some of the surprising ones, depression, anxiety. I mean, one that is I've always known, and even before SGS, was clenching, grinding of teeth. That was always a red flag to me, that was a sleep concern and not just a night guard. Put someone in a night guard Band-Aid. I knew that was, very much associated with sleep. But some of the surprising ones, and I think, like I said, would be easy for team members to spot, would be thyroid disease. Just, raising an eyebrow at least to seeing that on someone's health history. And people that have high blood pressure, diabetes, obviously, but those are the ones that can be not as well known, I think.
Actually, I love that you mentioned that. I've done a lot of these webinar and interviews, and I don't think a lot of people ever touch on thyroid disease. So that's a really great thing that you brought up. It's very important that dental practices out there really pay attention to the health history of the patient, because there's a lot of stuff there. I think the two main things that I see that are, I wouldn't necessarily say common, but you're most likely to see it in the dental practice you mentioned, was the clenching and bruxing. And I think a lot of people should understand in regards to GERD, like any type of like acid reflux, anything that you see on the teeth. A lot of people tend to think either that's from like an eating disorder or anything like that, but a lot of people don't tend to realize how that's correlated with sleep, and when the airway closes and then opens up, how all that acid rushes up and can damage the teeth. So that's really awesome.
I myself have thyroid disease, so I mean it's an easy one for me to chat with people about because I've done a lot of my own research on it, but it's really prevalent. You know, it's super surprising when it's a pretty common one checked on health histories. So
sharing that. I know that one thing I always like everyone to share on, anyone that I speak with in regards to sleep, is sharing any type of patient stories, whether it's patients that you've seen, any like personal folks that you screened, any feedback you've gotten from patients. Is there anything you can share so people could get an idea of how this can actually change a patient's life?
Yeah, sure. So far, we kind of started with this. We started with SGS back in November, so we're still pretty new, you know, to the sleep world and the sleep game and sleep medicine game. But we really started hitting it hard in after I came back from boot camp, and I'm sure we'll talk more about that later. But after I came back from boot camp in April, is really when sleep took a huge turn in our practice. So we've been doing a lot more since then. I say all that to preface that we haven't done a whole lot of sleep appliances. Say we've probably done 20 sleep appliances since April.
Gotcha.
And, you know, referred a few people out for PAP therapy. So I really probably can think of like one patient right now, just a good example. So this patient had been treating himself for sleep apnea with a device that he bought online. It was I know an oral appliance. I mean, it looked fairly legit as far as like the upper and lower piece. It just didn't have the bite component or the protrusive, you know, the things that you need to actually titrate that in. So he was just sticking this upper and lower rubber piece in his mouth and thinking that he was helping his sleep. And he tried, you know, did the best he could. He follows his sleep with a Fitbit app, and it kind of tells him, kind of like the Oura Ring, you know, how he's getting his efficiency is at night. But we chatted with him quite a bit. The hygienist, Sheer, and I have chatted with him quite a bit and got him to do, you know, a sleep study and determine for sure, you know, what his level of apnea was. And we talked to him about a device. We got him in a ProSomnus Evo, and he loves it. He loves it. You know, he says it's easy to wear. I go to sleep in it. You know, he doesn't have a whole lot to say, but I think the really cool thing is when his wife came in for her cleaning a couple of weeks ago, she shared with us that it's not just changing his life, but hers. You know, like it's affecting. We all know that the bed partner, the person that sleeps with the person with sleep apnea, is so much often more affected than the person who has it. So kicking, he would like thrash around at night, kick her a few times, and, you know, keep her up with snoring. So she said that that's changed a ton for her, but she loves to see the change that it's had in him. She said he wakes up and like immediately wants to go work out now. Like he has energy that he never had before. And it's kind of changed his life too. Like from her standpoint, it was funny to hear the success story more from her than him.
So aside from being a sleep care coordinator, we can possibly add marriage therapist per se
Right?
to your title.
For sure.
Bringing couples back together. I think that's a common story I hear, is not only, you know, helping the overall quality of life where they have energy, and trust me, for anyone who's not been tested for sleep, or if anyone who has apnea and they're being treated, they'll understand where I'm coming from. When a lot of people don't understand that they're feeling bad until they start feeling better, and the amount of energy you get from actually using your appliance or, you know, CPAP, is night and day. Like half of the time you don't have to reach out for coffee or anything like that, but that's really good. It does join a lot of couples back in bed together, because I know a lot of people tend to sleep in separate rooms due to snoring or things like that. It can cause. That's you too. Oh, bless your heart, Kary.
No, it was my husband. You want to tell you about my sleep story?
Yeah, please do. Let's go to that. Like, because it's passion starts from somewhere. Everyone that gets started into sleep and so forth, a lot of times they tend to have their own personal story or feedback of why they're in this field. So please share that.
It's not necessarily why I'm in this field, but it's funny that being in this field and screening for sleep allowed me to be able to screen myself for sleep. So the awesome Joel at oh my gosh, I'm gonna oh my gosh, let's so mispronounce it. Itamar.
My fellow Buffalo Bills fan. I love
Oh my
Joel.
gosh, I love Joel so much. He's my buddy. So he hooked me up with a watch pad to take home and evaluate my own sleep. And guess what? I have stage 1 or mild sleep apnea. So I had gained a little bit of weight, which we all know can increase like snoring and apnea itself. And my husband was telling me I was snoring like a freight train.
That's
I was snoring like a freight train. So I was in Invisalign at the time and wanted to wait until I was done to get an appliance to treat my apnea. And meanwhile, he was sleeping in the other bedroom. He, like 6 weeks, he was sleeping in another room. It was hard. It's hard not to, your spouse not to be in the same bed with you when you're used to someone being there. You wake up and he's gone. I'm like, oh man, he got up again. I must have been snoring again. But I mean, snoring's, I mean, it's funny. We think it's funny, but we also don't realize how dangerous and scary it can be too.
Gotcha. And you're in an appliance right now?
Yes. So as soon as I got done with Invisalign treatment, I started wearing an oral appliance, and I feel like I jump out of bed too. I know that sounds so silly, but I mean, I feel like I wake up so refreshed and rested that I want to jump up and tackle my day. Whereas it's just amazing, like what you said earlier, that people just don't realize your body is such an amazing piece of machinery. It just adapts to what it's gotten used to. It's gotten used to not getting great sleep and quality sleep and great oxygen, and you just adapt to that and you get used to it, and then you don't realize how great your sleep could be until you get it fixed.
You know what? I want to touch base on something real quick, because I think a lot of times I hear a lot of dental practices asking, when we start talking some about getting involved in dental sleep medicine, a lot of the things I tend to hear is, keep in mind when you're wearing a dental hat, you're thinking dental, and not really thinking medical in terms of obstructive sleep apnea and that of oral appliance therapy. When, in terms of, because I know sometimes people bring up, being worried about bite changes or things like that. And I could share my story too, but when you take out your appliance, in terms of how you get your bite back into place and the importance of how you got into the perfect position to begin with to avoid any type of really obnoxious TMJ issues, like what is like your morning routine when you take out your appliance just to get your bite back into place?
I mean, I kind of usually almost, I know I'm not supposed to say this, and I'll never let my patients hear me say this. I don't use my morning aligner, because like an hour into the day, like I'll go about my routine, I'll have my coffee, and I always notice that by the time I'm on the way to work, which is less than an hour after I've taken it out, it's already back to normal. It's crazy.
I use sugar-free gum.
Do
so
you?
In the morning, when I do my morning routine and so forth, I had a morning aligner. My beautiful dog chewed it up and ate it because he's a blessing. Yeah, isn't that swell? So yeah, I use sugar-free gum in the morning, and during my morning shower and doing my makeup and stuff like that, it just easily gets back into place. But I just wanted to mention that so I could let people know, like, we're not messing up a bite. We're not doing anything like that. You can help improve an area with an oral appliance as long as you do the proper guidance, and most importantly, finding the proper position, which we use the Echo Vision. I know you guys use it in your office too. So that way we're just not protruding the jaw forward as max as it can go, which can then cause issues and problems.
Oh yeah, it's been invaluable having that piece of equipment rather than, everybody. I think it may have been you that told me the analogy. It's like everybody, or maybe I heard it on one of y'all's webinars of somebody trying to wear the same. Everybody wears the same size shoes. Like you're just
John says that, yeah.
Yeah, you're just assuming that everybody in America wears a size 11, and then take that and put everybody in half that, and that's your protrusive biter. Like the Echo, I think, is a game changer on getting us to really fine tune that in and mitigate symptoms. I mean, we definitely want to put people in an appliance and not have them have symptoms and their sleep to be automatically improve. So yeah, anything we can do to do that, I love it.
Awesome. Now, in terms of being the sleep care coordinator, because I know every office is different. Those that are doing sleep, sometimes they have a team of people doing it, but normally if they have a dedicated person doing it, everyone always asks me the same questions, even clients. I always like to share this with other clients as well. Do you share any tips on how you approach the subject of sleep with your dental patients? Like any feedback to share with others? Because I know some folks just do a simple screening thing, others use some type of marketing that's on the walls. Like, what are different ways that you've approached the topic of sleep where you've seen patients been more receptive to it?
Oh, good question. I mean, in our office, our doctor and our hygienist or assistants are the main ones having the conversations with patients. We're lucky enough that I'm in a role where I am just mostly all sleep. I kind of keep my medical hat on, and the doctor and the rest of the team kind of keep their dental hat on, but then they screen for sleep. And the best way we've determined to do that is we've kind of added some probing questions to our clinical notes templates. So every time a patient comes in for a cleaning, there's a note template there to, if we haven't done it yet. So we're trying to get through the process of screening all of our existing dental patients for sleep. And so there's that note template there that kind of prompts them to check Malin potty, to check whether they have an enlarged tongue, a scalloped tongue. What else do we check? We check off their medical history, look at their medical history. Do they have thyroid disease, cardiovascular disease? Do they have a vaulted palate? Kind of all the anatomical red flags that we learn throughout the process of learning about sleep, as well as looking, like you said, at their medical histories, and if there are some red flags, acid reflux, things on their medical history that point us to a conversation about doing a sleep study. And I like to train and chat with my team about, getting patients to say yes to a sleep study. They look at you like, this is my dentist. Why are you talking to me about doing a sleep study? And that's something my doctor should do. And in our office, we use the watch pads. We send patients home with we have the disposable ones, and we have the one that patients can use and bring back. But just for ease of being able to do it, because I feel like when patients walk out our door, they're going to forget about everything we just talked about for the most part. They kind of get that glazed over look on their face, and they forget about a lot of the important things we talk about. But I get off on a tangent there. Sorry. So yes, our team kind of screens, looks for those red flags, and chats with them about doing a sleep study. And we kind of liken it and compare it to, like high cholesterol. How do they say, well, nothing's wrong with my sleep. I sleep fine. That's the most common thing that we get from patients. Like, my sleep's great. Why would I want to do a sleep study? Just because you say I have these things in my mouth, you have these things that are going on. And I explain it, it's like high cholesterol. How do you know you have high cholesterol unless you do blood work? I mean, how do you know you have a sleep condition if you don't do a sleep study? It's the same principle. High cholesterol doesn't hurt. Sleep apnea doesn't necessarily hurt, but you've got to do some diagnostic testing to see and rule it out as a possibility. So it's usually as simple as that, to try to have a conversation with them and get them to take a sleep study home.
One thing I wanted to ask you about, only because I know we had such a good time at boot camp. So for those of you that are watching and so forth, there's so many things the Sleep Group Solutions offers. We're very big on education. So I know that Kary was talking earlier about, she came to one of our 2-day courses, which is like an intro to sleep. It kind of gets you started of how to screen, what to look for, and what an actual protocol should look like in the dental practice. And then she mentioned how in April she attended a boot camp, which is an additional training that we offer to clients to kind of really push forward their sleep practice. So I know that you came in April, and a huge turn happened afterwards. If you can explain what boot camp was and what you learned from there.
Oh, sure. I mean, it was this. I know this sounds so cheesy, but it was really one of the most amazing experiences of my dental career. I just feel like when we sign up with SGS, you provide a day full of training for us, and the lovely Rebecca Leahy comes and gives us this amazing, or whoever your trainer is. We had Rebecca Leahy, lucky enough. And they give us all this great information and you're just like, yes, 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 you're absorbing all this information. And then all of a sudden she leaves and we're like, oh, what did she say? We just felt like we were drinking from the fire hose that day. And it really is true. It's just so much kind of coming at you and you have to figure out how to put this together. And when you told me about boot camp, and I decided to come, now I see the massive benefit. Like, whoever's listening, if you're on the fence or if you don't know what boot camp is, ask Cindy and she can give you more information. But it was basically a 2-day intensive of, does Rebecca do all the boot camps?
She does every single boot camp because we go over from A to Z.
You
what
get
to do awesome. Every little minute of an appointment.
Oh man, it is awesome. I have my notes from it I still refer back to, but like from medical billing questions to appliance choice to problems and things that you can encounter when patients do have symptoms from appliance therapy. I'm trying to think, screening. I mean, just going over the sleep study, like understanding like the guts, like really getting into a sleep study and understanding everything about it and being able to confidently explain that to your patients. I mean, I think a lot of it is so much about confidence. Like if you're confident in what you're talking about, that you're going to be able to relay that to your patients. And boot camp kind of gave me the confidence I needed to really take the next step in our sleep medicine practice. And at that point, I kind of came back and just took over. So before, the doctor was going over sleep studies with patients. And there was one day where she had to see a dental patient. And I'm like, I guess I'll do it. I'll wing it. I'll go over this. I was already making the presentations for her. I make this Google slide presentation advice from one of your training videos I watched of someone saying that they put together a presentation for their doctor. So I started putting presentations together for my doctor. Anyways, I just did it myself and I felt great about it. I mean, it was so rewarding to be able to not just go over this condition with someone, but how I could help them with it. And I took over after that. Like I said, it gave me the confidence I needed to feel comfortable going over a sleep study with someone, answering the questions when they do have questions about it. Made me feel so much better about using the Echo Vision. What did we have? Like a full day, half day or something on just Echo Vision training and getting
lots of hands-on. Yeah.
Yes. Lots of hands-on. So it was awesome. I don't even think twice about going to boot camp and not just going and not just sending one person, but your whole team has to go. That's one thing I so wish is my whole team would have been able to go, because now I've found myself coming back and just trying to drill some things in my team's head and like, y'all should have just been there with me.
I would have loved to seen them there. And let me tell you the difference of, because seeing clients from when they first start and then you see them afterwards, like there's like a sense of like pride there, because the turnaround I've personally seen for you from then till now is ridiculous. I've done some video Zoom sessions with you, watching you work with patients, and you sound amazing. Like really, really good. Like super proud of you. So
thanks to you.
But you have to put in the work too.
Tell them about all the Zooms we had before that where you were telling me what I was doing wrong.
You know what? But you have to put in the work though. Like we can give you the recipe and the tools and everything on how to bake a cake, but you still got to put the ingredients together and bake it. Like there's only so much we can do, and we'd be more than happy to do that for you guys. But you really took it seriously, and you wanted to be better and doing all this stuff, and you're doing phenomenal now. Like we could really see the difference. So that's really, really great. I'm glad you came to boot camp. Thank you for that shameless plug. We have boot camp coming up in October 28th and 29th.
Change my world.
I know. It's awesome. And we're working on some dates for next year. In terms of, because I know you already told me that you tested yourself for OSA. Has anybody else in the office been tested for OSA, people that work there in the practice?
No, but we're about to. I mean, not all of us. So Shira, our hygienist, she was the one that went to your initial 2-day training, and she got tested then. I've been tested and the doctor's been tested, but we were working on getting the whole team tested because of Joel with the Watch Pat is has been great and giving me some tips. Like, first of all, just make sure your team has actually had a sleep study done, because there's nothing like having that experience to be able to share with patients and just how easy it is to get tested. It's silly not to.
100%. Now, speaking on that, and I love that he said that, and I say that all the time, because there's one thing to talk to patients or anyone about OSA and sleep, but if you're speaking on it from experience, especially you as a user of oral appliance therapy and what it's done for you, do you feel that by you being tested and you having that experience yourself, that it comes out better when you're speaking to patients about sleep?
Oh my gosh, yeah. I mean, it's invaluable. I feel like, I mean, not that I wanted sleep apnea, but it's there. I have it. And yeah, I think it's invaluable. Patients love to hear that you've been through what they're going through and that, we're not just trying to sell them something. We're really trying to improve the quality of their life and keep them healthy for life, keep them here with us for a long time. And they see that. They see that come through when you're chatting with them about this. And especially when you've been through the experience yourself. And, yeah, of course you can relate when you've gone through it.
Yeah. I always ask this, and I know I didn't kind of pre-ask you this before, but just for some feedback, because a lot of people always tend to ask about appliances. Is there a particular, I'm a firm believer, there's no cookie cutter go-to appliance that you can use for all patients.
Right.
An appliance is made depending on the patient's needs, like if they grind or anything like that, if it's a Medicare patient, etc. In terms of the appliances that you have put cases out and so forth, what are the types of appliance you're seeing more for your patients? Like Herbst appliances, anything like that?
You mean like brands or companies?
Not necessarily brands, like or yeah, is there a go-to like lab or
Yeah.
appliance that you prefer or like
I
better?
mean, I have 3 that I rotate between, and it's kind of based on patient need.
Okay.
If a patient is having, like, they've never worn anything in their mouth before, they've never worn a night guard, they've never worn a retainer or anything, I'm worried about them gagging. I use the most slim and trim appliance that I have, which is I love the Elevate by Serena Sleep.
Okay.
It's great. It really doesn't require a whole lot of really almost any of them don't require a whole lot of delivery. The labs are so great at getting these things honed in, as well as us getting that initial record with the Echo Vision. It's almost like we don't have to touch things when we deliver them, which is great because dentists are used to having to touch things when we deliver them instead of just hand them to patients and be like, all right, have fun with this. So I use the Serena Sleep a lot. I mean, the Elevate from Serena quite a bit. We use the ProSomnus Evo. We love that one as well.
That's
My
a popular one.
Shira wears that one. She's watching. Hi, Shira. She wears that one. I wear the Elevate myself. And then another one that I've really been loving and using a little bit more, we've used it on a couple of patients, is called an Oasis. And with the nasal dilators, I just think that's so cool. People that have some trouble breathing through their nose, that those little dilators inside just kind of spread those nostrils a little bit and help them get some better nasal breathing at night.
That's kind of cool, actually.
It really looks funny. It looks like, I call it the catfish or the butterfly appliance. It looks super weird. And patients look at it and go, you're not putting that in my mouth. But the 2 that have worn it absolutely adore it. They love it. They love it. So
I actually wouldn't mind looking into that. And with my appliance that I wear, I use also what are called mutes. They're like basically like a nose. Yeah, it just opens up my nasal passages. So I'm just really breathing really. So I just use that in combination and it works. So it's kind of similar to what that Oasis appliance does.
yeah.
Thank you for sharing that little tidbit. Everyone always asks what someone's preferences for appliances. So I thought I'd ask and share.
Sure.
Is there any piece of advice that you can share with others of anyone who's maybe thinking about getting into sleep, or they're on the fence whether they should get started or not? Like, is there anything that you can share of why they should?
Well, I mean, the why is saving their patients' lives. I mean, aren't we all concerned with keeping our patients around for the rest of their lives and, not having them have strokes and heart attacks, and trying to prevent these things with, treating them for OSA, or at least screening them for OSA? I just think it's super important. It's one of those things, kind of like when you learn about religion or when you learn about functional medicine. It's one of those things, once you learn it, you can't go back. Like you got the information. There's no way, now that you know this, you can go back and not do this for your patients. So advice, it was quite the daunting task to put this together for our office. And the best piece of advice I could give someone is, when they're chatting with you guys and getting started with y'all, that they give themselves a couple of months to really just put things together before they really start implementing this in their practice. Like, get your plan put together, get your team on board, get your team trained, go to your boot camp, like kind of pre-think about this, maybe even months in advance before you put this into place in your practice, because there are a lot of moving parts. Find that perfect person on your team that has passion for wellness, which, I mean, I'm not saying I'm perfect, but I do have a massive passion for wellness.
Kind of close, Kary, you're kind of close.
So, I mean, it was obviously going to be me all along to be that person to implement that in our office. But you guys give us such great tools. I mean, the portal with all of the training videos, the paperwork, the things that we need to like put our screening forms together. I mean, it takes a little bit of time to put that together. So that's probably the biggest piece of advice I can give.
That's awesome. And keep in mind for everyone watching, like getting involved in sleep, like we'd love to, have you join Sleep Group Solutions and have us help you, because one of the things that we have is a huge support team. There's a dedicated department just to help clients at all times. I know a lot of clients have my cell phone number, including, I was supposed to say Kathy. Kary Helmer. But yeah, like that's what we do. We just want to make sure that if there's a question you have and you need help, like we will try to do our best to help you, even if we have to film a tutorial video. And I'm the queen of tutorials. Like I've made so many, like whatever needs to be done, that's what we do. So it's very important that you guys know that there's a support system.
Not just that too. I mean, not just you guys, but the support system, like we're broadcasting this on your Facebook page, right? And the people in these groups, like these dentists that I've never even met before, there has been nothing like this sleep community. Like the community of people, the people that I've never met before in my life that are there and willing to help me. Like ProSomnus, I was able to call ProSomnus for some help with a problem patient I was having. They gave me Dr. Mark Murphy's cell phone number, and I'm able to text this like amazing sleep leader in our community, like, hey, I'm having some problems with my patient. What do you recommend? He's like, okay, do this, 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 and this. I mean, just the support of your peers in this group has just been, I mean, oh my gosh, Dr. Kent Smith, he took me kind of under his wing and added me to his little email group. And I'm like a little nerd fly on the wall looking at all these conversations about sleep. I love the community of the sleep people and all the people that you guys have put together and all the people that, are doing this to help their patients. It's been a huge, happy part of doing sleep medicine.
I think that's my favorite thing. Something that we offer to our clients. I know you're in the group. We do have an exclusive Facebook group that's just for our clients. So anytime somebody asks a question or if they need advice, they have a sleep study and they're like, you know what, I'd love feedback on this. Everyone's posting in there. It's like our own little DSM forum, and then everyone jumps on, here's an appliance. This is what I did. What do you think? And everyone's sharing their bit. Like everyone is so eager to help. And I love that community that we have.
It's a little family. I love it.
It's our little sleep family. All right, let me see. We are it's like 8:40 here. I'm going to go ahead and share a screen here. So I know that we have some courses coming up. So I just wanted to show everyone what we do have coming up here. And this here's Dr. Harrison with one of our amazing clients, Angela Drake. So these are our upcoming 2-day courses. There is a course that's not listed on here that we just added. It's December 2nd and 3rd in Tempe, Arizona. So we do have that available as well. Our details are on the website. But this is a 2-day course. It combs over everything in regards to sleep medicine. It's going to cover the signs, the symptoms, what you should do at each appointment. It's going to cover medical billing and insurance, networking with physicians. We will ask for volunteers at all of these courses of anybody who wants to get sleep tested themselves. So if that's something that you're interested in or you were wondering about, I really do implore that you look into this. You could just go to sleepgs.com, and then you'll see all the upcoming courses, and it kind of gives you a breakdown of what you could expect at a course. We'll also be doing airway testing, so you can physically see how your airway could respond to oral appliance therapy, because that's one of the benefits of the EchoVision, is when you're testing patients, you can predetermine if they're even a candidate for oral appliance or if they'll even respond to it. So that way we're not wasting your guys' time, chair time, and so forth, or wasting the patient's time and money with an appliance that won't necessarily work for them. And it helps pinpoint that position where you're not necessarily having to protrude their mandible so much forward. By introducing some vertical, minimal protrusion, you can find that sweet spot, hopefully where they can wear an appliance. But we are offering 50% off of the courses for those that watched the webinar. You could just use that code at the bottom for Sleep TV 50. And keep in mind that if you're unable to travel, or if you can't make any of these dates that we have, for non-existing, if this is something you're looking at bringing into your practice, we can come to you. So we do have opportunities where we can do in-office visits. I know that's how it started with Kary here, where they basically came to her office, did a demonstration, went over sleep, just to get it going and get it started. So we can easily do that for you without a problem. You just have to give us a call here. I'm going to leave this up here. I'm going to take a peek here. I have Faustina in our back end here. She's monitoring our Facebook group. So I'm just checking to see if there's any questions on Facebook. And let me peek at here. Somebody was asking about what appliance is easy and good to use if there's any universal type. So I know you touch base, Kary, on the 3 you particularly like. I want to make sure that people understand that when it comes to oral appliance therapy, there is no magic appliance. It's really based on patient needs, just like Kary said. But keep in mind just some pointers. If you have a patient that bruxes, you definitely don't want to put them in a dorsal fin appliance. I firsthand could let you know that I brux like it's my second job. And my first appliance that I got, because I get hookups, I was like, oh, let me get this appliance because I liked it. I broke one of the fins off because I brux pretty heavy. Yeah, it was scary. But thankfully I woke up and it was just, the fin was just hanging out on the side of my mouth, and I spit it out like, what the, yeah, it was crazy. So for someone who bruxes, you definitely want to put them in a hinged appliance, like an ERPS appliance. It gives them lots of lateral mobility, protects their airway. So that's important. If you're seeing Medicare patients and you're opting into Medicare services, you will need to use a Medicare approved appliance for those, which would be any type of hinged appliance. For anyone who's a cheek biter, there's different labs out there that make the hinges on the side a lot smaller. I mean, I don't know, Kary, if there's any other appliances that you could think of based off of needs.
I mean, the most common one I see, and like I said, being kind of a fly on the wall in Dr. Smith's group, where he had a quick webinar about appliance selection for a few dentists, and I was a part of that. And I really saw a very common theme of like the ProSomnus Evo. I know that's considered a dorsal fin, right? That has the, yeah. So, I mean, most of them have not had problems with the fin breaking off, but it's always a possibility, and it's always a possibility of like aspirations. So you definitely don't want to take a chance knowing that it can break, but it is I think that's a really good all around appliance with that exception. I'm not that there's a one size fits all, like you said, but it's probably my most common, that between that and that Serena, that Elevate Serena appliance.
I'm looking on here on Facebook. I see a lot of people are saying hi to you. So Laura from Brady Billings saying hey. Kathy Marie, she works with Dr. Rosenbaum. She's like, hey, she's saying hello as well. I have Susan here. She made a post here saying my doc and our team are going to boot camp this month. So excited. So she's going to be at our last boot camp of the year, which is our Halloween themed boot camp. We have a costume contest, all this stuff. Hi. So we're kind of going big for ends of year. We have Vicky here. I would love to learn more about Oasis. Yeah, I'll totally send her some information about that. And I'm assuming she'll probably want information on the one that you mentioned with the
sure, I'm happy to share
dilators. Yeah, that'd be awesome. So this is really good. I don't see any other questions here. Let me take a peek in here. Bum, bum, bum. Kary, you're a rock star. Love, your favorite dental hygienist.
Oh my gosh.
Yeah.
Wonder who that is.
All right, so we are pretty, I mean, we're pretty good here. I'm looking on here. I don't see any other questions here. Guys, keep in mind that if you have any questions whatsoever in regards to sleep, if you have a question later on for Kary, let me know and I'd be more than happy to ask her and get you guys in touch. We're really all about helping each other, especially the more people we get involved in sleep, the better, which is super important. So that's really, just really ask us, let us know. If you guys have any questions in regards to sleep at all, I'm going to go ahead. My email is, it's C Acevedo. So C as in Cindy, ACEVEDO at sleepgroupsolutions.com. You could always give us an email to customer care at sleepgroupsolutions.com. And then we could at least point you in the right direction based on your practice needs. But first and foremost, I'd love to see you guys all at a seminar or boot camp, whatever floats your fancy, or we can come to you. Keep in mind, if you just rather us come to you guys and get the whole team involved, if all of you guys can't travel, we'll do whatever we can to get you guys started. I think we are good. Yeah, no questions here. My love, Kary, always a pleasure. I always love seeing your face. The one thing that I take from you guys getting started into sleep, I'm very happy you're doing sleep. I'm very happy that you guys are saving patients' lives. But most importantly, in this process, I've gained a friend. I love you immensely, and I'm very proud of you.
Thank you, love.
You're welcome. Guys, thank you so much for joining us. We'll go ahead and process CEs and the attendance report tomorrow. And if anybody wants a recording of the seminar, just please let us know. And it is going to be available at all times on our Sleep Group Solutions Facebook page. Thank you guys so much. Have a good evening.
Thank you all.